size dissection is going to focus on sitting knee pillow squeezes. For this one, you're going to want to find a chair or bench to have a seat on and a firm pillow. Have a seat on the bench. Make sure your feet are hip width apart, pointing straight ahead. Place that pillow between the knees, and then you want to roll your pelvis forward to place an arch into the lower back. Hold that arch in the lower back as you gently squeeze and release that pillow, using about half your strength. Some of the things you want to avoid: one is no slouching in this E size. So you can see here, Carrie's upper back is rounded, her lower back is flat. We want to try to avoid that position. You want to roll that pelvis forward, placing that arch in your lower back, and squeeze and release that pillow. Other things you want to avoid is letting the upper body lean back. As you can see here, now the shoulders are behind the hips. That's one position we want to avoid. You also want to avoid the opposite, where the upper body starts to lean forward. You can see here now the shoulders are in front of the hip joints. So those two positions you want to avoid. You want to keep the shoulders above the hips, keep the pelvis rolled forward so there's an arch in the lower back as you squeeze and release the pillow. Another thing you want to avoid is making sure the heels aren't lifting up off the ground as you're squeezing and releasing the pillow. The feet should stay flat on the floor. Okay, good. Do about 30 to 60 reps and then come out of that. We'll take a look from the front view as well here. So again, you want to make sure those feet are hip width apart, pointing straight ahead. So you don't want the knees and the feet to get wider than hip width. You don't want the toes to turn out. And again, no slouching here. So once you're in this position, take the pillow out, take a look at your feet, make sure they're pointing straight ahead, hip width apart, and then you roll that pelvis forward to place the arch in the lower back, and you hold that arch throughout the exercise. The primary purpose of this exercise is to remind the abductors and adductors of their primary functions, provide strength and stability to the hip and pelvic area, as well as promote the proper position of your lumbar spine.